Welcome, everyone. Here we are in the first of a webinar series that's connected to this Trauma, Gender, and Substance Use Project. And I'm Nancy Poole, the Director of the Center of Excellence for Women's Health in Vancouver. And you'll see all the other folks who are joining me this morning to act as panelists and discussants and presenters. So I'm going to turn it over to Rose Schmidt to begin to give an introduction to the webinar.
Thanks, Nancy. So today we will be providing you with an introduction to the TGS project that this webinar series is a part of. We'll then provide you with some key concepts of trauma-informed practice, look at some recent developments in the field, and finish with some next steps in the project. After each section, we'll pause for discussion and to answer any questions you may have. So feel free to type in any questions you have into the Q&A box that should be to the right side of your screen. The trauma-informed practice is a critically important approach to improving substance use service programming, policy, and health promotion. However, without integrating gender into this approach, issues of equity could be easily missed or ignored or perpetuated. So this project is on the forefront of merging these approaches and expanding the evidence base related to trauma-informed and gender-informed approaches to substance use policy and practice. The TGS project is a 2-year knowledge exchange project that's funded by Health Canada. In this project, the Centre of Excellence for Women's Health has partnered with the Canadian Centres on Substance Abuse, as well as people working in the substance use field from across Canada. We will be developing evidence-based guidance, training, public health messages, and knowledge products, such as fact sheets. The goal of the TGS project is to guide the further integration of trauma-informed, gender-informed, and gender-transformative practice into the substance use field in Canada, which will include prevention, health promotion, treatment, harm reduction, as well as policy. So we'll be using various mechanisms to achieve this goal. We kicked off the project in November with a national roundtable meeting on gender and trauma-informed approaches that included 2 representatives from the substance use field from most of the provinces and territories. This webinar series will be ongoing over the project. We'll also be conducting some pilot testing with the goal of expanding our evidence base. So for this, we'll be working with 4 programs or service systems to create training, messages, materials, or policy shifts, and then measuring the outcomes. We will also be developing materials for service providers all across Canada, including evidence summaries, an updated evidence-based guidance, and practice materials such as fact sheets, pamphlets, and posters. We will also be offering a community of inquiry as a co-learning mechanism. So we'll be offering 3 short-term communities of inquiry that will meet once a month for 3 months each. For people who are interested in learning a bit more in depth about a particular topic, and our first topic will be starting in April. And finally, we'll be hosting a workshop with CCSA at the Issues of Substance Conference in Calgary in November 2017. So as I mentioned, this webinar series will be ongoing over the 2 years of this project. Our next webinar will be Gender-Informed Approaches in the Substance Use Field, and it will be held on March 14th at 9 a.m. Pacific, 12 p.m. Eastern. A number of other topics have been suggested as potential topics for upcoming webinars, including trauma-informed policy assessment, in-depth look at bringing trauma-informed approaches into particular settings, working with trans, gender non-conforming, and non-binary populations, combining gender and trauma-informed approaches, and trauma-informed approaches linked with healing in Indigenous communities. We're really happy to hear from you about which of these topics you might be interested in the most, or if there's any other topics that we haven't included that you think would be a good topic to have in our webinar series. So the goal of today's webinar is to summarize what we know about trauma-informed practice, highlight emerging research and practice wisdom on trauma-informed practice that can be applied to work in the substance use field, and to provide you, the participants, with an opportunity to share what you're working on and to offer ideas about what you might want to support your practice.
Thanks, Rose. So, yes, we're really fortunate to have this national project with lots of interest from across the country to be working on trauma and gender-informed approaches with many provinces and territories on all these activities. So the next section of this webinar is just a bit of a review of some of the key trauma-informed practice concepts, because many jurisdictions have really been working on these issues, and so we just kind of wanted to remind ourselves of all the work that's being done, and then talk a little bit in the next section about what we've been learning as we've gone back to the literature and talked to jurisdictions across Canada about what they're doing. So kind of first this review, and then a look at where we're going and what's being currently done. So, you know, at this point, we've seen trauma-informed practice being enacted in really a lot of different settings, and this is an example of showing with pregnant and parenting women, in homeless contexts, in child and youth and family services, and in the addictions and mental health field. So really lots of people paying attention to trauma-informed approaches. So we're kind of seeing it as a movement, you know, that includes changes in the way we think about how we provide social and healthcare services. And really attending to the fact that it's much more than simply changes in our practice with clients, although that's a key piece to it. It's also about our service cultures and agency policies and practices, our interagency and intersectoral work, and of course the work to change social conditions that give rise to trauma-informed, the need for trauma-informed approaches. The interesting thing for us is that as we've looked in the literature, we've really seen how TIP is built upon contributions and developments from a number of fields, from public health, women's health, Indigenous wellness, and neuroscience fields. And this is kind of a picture of some examples of key documents in each of those areas. And I think what's so interesting about this work is that it is drawing from so many areas of wisdom and knowledge and evidence. And it's giving us both a lot of challenges to think about how to be transdisciplinary in that way, but it's also giving us a lot of opportunities to draw from the wealth of ideas and practices that have evidence in each of these various areas. So really, I think a really exciting time for us to be quite creative as we weave together the work from all these areas. So, you know, basically, trauma-informed practice refers to integrating an understanding of people's past and current experiences of violence and trauma into all aspects of service delivery. And our goal as service and systems is to avoid re-traumatizing people and to support safety, choice, and control on the part of service users and service providers in order to promote health and healing and healthy organizations. So the thing that's so important, I think, for us to get in the substance use field about TIP is that it's not a specific treatment modality. It's not even a treatment technique. It's really much more of a paradigm being brought to the field. And, you know, part of it is really interesting, and that I think has challenged a number of people, is that it's not built on that medical model idea that, first of all, you have to disclose trauma and then you have to treat it. But trauma-informed approaches are not built on disclosure, but are built on this broader understanding that a lot of people coming to the substance use field will have these histories, and we need to work in a way that really supports their engagement and health. And, you know, a key part of that is that we are linked to trauma-specific treatment and healing. But, you know, that trauma-informed work itself is not about treatment of trauma per se. So really, you know, I think that's really changed our thinking in lots of ways. Here's the way the Substance Abuse and Mental Health Services Administration in the U.S. has kind of framed it with 4 R's. I think it's kind of an easy way of remembering it, about realizing the impact of trauma, recognizing signs and symptoms, responding by fully integrating these understandings into our policies and practices, and really actively thinking about resisting re-traumatizing people who are coming for our care. And the Substance Abuse and Mental Health Services Administration in the U.S. has done some interesting things because in creating these different kinds of documents, the TIP 57 being a very detailed document, and the other ones being more conceptual about how we bring it in. And the third one there in the sort of pastel colors has a thing on the cover that says something to the effect that, you know, it's as much about social justice as it is about healing. So really, you know, taking us into the determinants of health approach. So TIP's important for the substance use field because so many people coming, you know, to us have used substances to cope with traumatic experiences. And this, you know, and that trauma can really affect service access and engagement. And, you know, in many ways, really important for us to be trauma-informed in order to, you know, overcome some of the mistrust and reluctance to engage and the, you know, the dropping out and the ambivalence that people come with. And if we can see it as, you know, grounded in trauma, not as being willfully, you know, non-compliant or whatever, then it really shifts the way we provide services. So, you know, I think it behooves us in the field to be part of the movement, to be recognizing and helping people, being healthy ourselves as we deliver services, to really be building this interagency and intersectoral nets of support for people, and really making links to the truth and reconciliation calls to action and thinking about cultural safety and as well as gender and trauma as we're doing this work. And the last piece I just wanted to put in the review was just a real focus on the idea of healthy organizations as being a big part of trauma-informed practice. And really, you know, recommending the book Restoring Sanctuary by Sandra Bloom, as she describes really well ways in which organizations interested in trauma-informed approaches really bring these various qualities into their practice. And as much as we've done manuals on how to change our work with clients, I feel like this is an excellent resource for us thinking about how we bring in this level of work into our organizations, recognizing that on the organizational level, we often enact, you know, many of the same kinds of things that we recognize as trauma-related in our practice with clients, that there can be a lack of safety and a lack of good communication and various conflicts between different levels of staff as to what defines our treatment and prevention and harm reduction approaches, and really a lack of a clear, coherent theoretical model for delivering services that's grounded in trauma theory, et cetera. So lots of opportunity, I think, for us as we go forth on this part. So I'm just going to stop for a bit and see if there are any questions that people have typed in that we want to answer, and give Holly, Lucy, Denise, and others a chance to comment. Do we have any questions there? Not really a lot of questions on the content. I don't know, Denise or Holly, do you want to make any sort of comments on that first review piece?
Hi, it's Denise. I think for me, what I want to say is that, first of all, Nancy, I think that was a really great summary of where we're at in terms of initiatives going on across the country in terms of addressing trauma-informed practice. And I think I just want to encourage everyone that is on the phone. Many of you have made many steps within the implementation of trauma-informed practice in organizations and clinical teams. And just to remind everyone that it's a journey, that it's never really done, and that we constantly and continuously learn from our clients and from staff and those of us that are utilizing this approach. There's not an end goal.
That's for sure. Hi, it's Holly from the IWK. Yes, just to elaborate on that, I think that's a really great point that, you know, we're all doing things currently, I think, that are trauma-informed, and it's just that awareness of why we're doing it and what we're doing, and just being maybe a bit more conscious of that on a systems level. And I think the great thing about trauma-informed practice and approaches is that there is a part for all of us in this to do something. And I think what really stands out, it is that systematic and collective approach. So I know in our organization, when we look at who plays a role, it's everyone. It's everyone from our clinicians, our physicians, our volunteers, our cafeteria staff, protection services staff, IT staff. So it's really people acknowledging that, you know, I really do play a part in this. And again, as Nancy said, it's not on the treatment end, it's on, you know, the end of what can we all do in our own roles and our own ways to be trauma-informed. And I think that's a great place to start because we all do play a part.
Mm-hmm. Hi, Nancy. It's Lucy and Julia here, and
hello to
everyone else on the line. I apologize. We had a bit of a glitch in our technology here, so
well,
we were a little bit
I'm
late
glad
getting
you're here.
on.
I hesitated to ask for you because I wasn't sure if you were totally on yet.
Yeah, well, thank you for that. But we're at least on the phone now, and we're getting on the computer.
Great. So any thoughts from your point of view on that sort of overarching thinking about trauma-informed practice as a paradigm that we need to, you know, bring into the substance use field?
Well, it's interesting. Julie and I were just talking this morning in preparation for this, and just talking about, and I think, Holly, you just made the point so well, and you too, Nancy, is just about the ongoing nature of this, that we are constantly bringing our lens out, almost virtually carrying it around with us, and just challenging ourselves and challenging the sector we work in and other sectors about whether or not what we're doing or what we're proposing is both gender-informed and trauma-informed. Right from, you know, the front door to the policy level. We're doing some work now with the ministry through the DTFP initiative, looking at common assessment tools across the province, and, you know, really examining those questions and looking at whether or not they're trauma-informed, and finding a voice for ourselves and for other women's programs to raise those concerns. And this, you know, the victories are large and small, and we just recently, as recent as last week, were invited to add our voice in terms of training to the assessment tools to ensure that they are, in fact, trauma-informed. So that was a big kind of point of acknowledgement provincially for us, and we're really pleased about that. And then it's, you know, it's the smaller things as well. It's just on a day-to-day basis, And so the work goes on, and I think in a way that you know, we'll look back a year from now and wonder why we did something the way we did.
Yeah,
and I really welcome
it's an evolving process for sure.
Growth. And
now I see lots of great comments and questions, and I think I'm going to pause on answering them until the next group of discussion, because some of them are covered further as we go along here. So let's go forth and talk a little bit about some of the updates that we found when the Center of Excellence for Women's Health staff went to both the academic literature, also to look for online resources that are, you know, what we call gray literature, non-academic literature, and also from doing a scan and having some discussions with people on in various web meetings about what they were doing in each of the provinces across the country. So this next section has a number of slides about, you know, what we found in various levels of service and with various populations as well. But I must apologize before I go in that we couldn't, in the space of time we had, include all the examples we found. So, you know, lots more, which we'll discuss at the end, that we've gathered into documents to share with you. But we did find lots of work being done in jurisdictions across Canada and internationally at these different levels of service in the substance use field, at agency levels, in doing staff training and wellness work, et cetera, by and with interagency partners, and also in just, we found lots of resources and educational materials that people were you know, posting online and sharing. In the research area, in the academic literature, we saw lots of articles about evidence for, you know, using this seeking safety model, which we see as kind of partway in a trauma-informed approach and partly having trauma-specific aspects. But, you know, it was definitely the most studied and, you know, has really positive impact in terms of being present-focused as opposed to, you know, having to tell your whole history. Really conscious about how to create safety, how to make these connections between trauma and substance use. And some great ideas, skills around grounding, et cetera. So there's many excellent pieces within that, that manual. It's had lots of study. It has shown effectiveness in helping people improve safe coping skills and develop a therapeutic alliance with the service provider, and has shown some benefits in terms of actual reductions in the substance use area as well as the trauma area, although in some evaluations this hasn't been sustained. Now, the folks at the Jean Tweed Center, Lucy and Julia are on the call, and us from the Center of Excellence for Women's Health, and Holly from Nova Scotia and I have all been busy, you know, building guidance around the substance use for substance use treatment and other settings in Canada. So there's lots of resources out there to for people to think about the translation of trauma-informed practice into substance use treatment settings and even broader in Canada. And there's been a number of great resources on how to weave in this idea of trauma-informed, wellness-oriented cultural interventions in Indigenous settings. And I've put a lot of examples on this slide. Renee Linkletter's Decolonizing Trauma book on the left-hand side there has some excellent examples from her interviews with Indigenous healers and experts around how they're both doing trauma-informed and trauma-specific work in terms of supporting healing with Indigenous people. Lots of other, Colleen Dell's work is down at the bottom there, leading a team of Indigenous and non-Indigenous people from across Canada in designing an Indigenous wellness framework for substance use services, particularly the NADAP services in Canada. Michael Yellowbird's work on teaching mindfulness with an Indigenous lens. So there's really a great deal of work being done in terms of resources around working on substance use in Indigenous contexts that bring in the concepts of trauma-informed practice. We saw lots of examples of trauma-informed practice in community-based substance use services, and this is one example from the Victoria Sexual Assault Centre, who did an adaptation of the Seeking Safety model to add a front end to a treatment-oriented group for women with both trauma and substance use concerns. Really interesting front-end piece, offering a chance for people to build some basic stabilization and coping skills before making choices about the first 6 weeks of the group and then a second 6 weeks of the group. And women really finding in the evaluation about how much that having that choice around going in a paced way towards choosing what level of support they wanted on these issues was really, really very helpful. In another community-based setting for women in Winnipeg, in the Mothering Project, they've been doing some excellent work on weaving trauma-informed approaches into a pregnancy outreach program. And you can see there from some of the things they're doing, such as yoga and mindfulness activities, drum group, and lots of other aspects of trauma-informed practice, like system navigation with women, low threshold intake process, and most importantly, that first point, really valuing experiential wisdom and the women driving the content of the program development. So some great examples we found out there. We found some academic literature on integrating trauma-informed approaches in harm reduction contexts. And people, for instance, Iris Torcella's work on the bottom there really being about the importance of working in a trauma-informed way with women who are accessing harm reduction services in the downtown east side, a real preference for a trauma-informed approach rather than a trauma-specific one. And the same kind of thing with Indigenous clients accessing methadone maintenance therapy, also in that context in the downtown east side in Vancouver, really finding, the broadening it out to be looking at determinants of health more broadly is really an important piece. In prevention settings, we've been seeing a number of things beginning to appear in the literature. The first is an article that reviews various school-based drug use prevention programs and mentions how self-regulation training has been built into a number of them. And the second one is a brand new one that we've just seen in the literature that talks about a process of involving young adolescents, primarily girls, with high rates of adverse childhood experiences in building an app that supports various skills around navigating substance use when you've had a trauma history and many other aspects of health as well. So just interesting to seeing how people are able to take what we know about trauma-informed approaches and build it into different levels of care. And as I mentioned before, the all-important piece around, peers driving the work in this area, really helping us understand what's helpful, and, a number of new resources, including the one in the center that's a peer support guidance for peer facilitators of groups who are working with women with substance use and trauma and mental health concerns, and really giving them a good grounding in how to be really wise in the delivery of peer support with people with trauma histories. The one in blue there is really interesting because it talks about how people are bringing in trauma-informed approaches to community development processes and thinking about how we need to involve people in community development, that top level of changing social conditions, so to speak, in the trauma-informed diagram, and really thinking about, what is the kind of supports that can really make a difference in terms of people being able to successfully engage in community-level change by bringing in basic trauma-informed practice approaches. So we're really seeing lots of people making changes. And here's an example in the child welfare practice of an organization that has really thought through what it is to have trauma-informed child welfare. And so you can see they've really focused not only on the children's well-being in this kind of systemic approach, but also the family well-being and resilience, and the well-being and resilience of those working in the system and the linkages to other systems. So really, moving us from this place of only being about individual change to be really thinking about trauma-informed as something that is all about wider change. We found lots of material on workforce supports. The top one there on When Compassion Hurts has been developed by the Best Start folks in Ontario for prenatal workers. But lots of good information, and that little chart on the bottom right-hand corner comes from that particular booklet that you can download from their site that really compares the idea of burnout with vicarious trauma and secondary trauma, and talks about, the importance of understanding and applying supports for all three different things. The Staying Deadly is a great resource from New Zealand that really focuses on substance use system providers and how they can really stay healthy as they work with people with trauma and substance use issues. So really great resources, and of course I've put the Restoring Sanctuary book again by Sandra Bloom that I think is extremely helpful in designing how we support people to deliver trauma-informed services and be healthy themselves. And in general, I guess I did want to stress that idea that really a lot of people are looking at kind of an agency-wide tip implementation using learning models, such as this group in Australia that was implementing Signs of Safety, which is an approach to child welfare practice that includes an understanding of trauma. And they really focused on this idea of peer reflection and feedback initiatives and deliberate ongoing coaching and supervision, and really saw that as critical to our work. As Lucy said early on, we keep learning, and we'll be thinking next year that, that we need to be doing things that we didn't even imagine this year. And I think that idea of this ongoing learning process is really central to that we consider this not as something that we're going to have perfect first time out, but really it becomes this process of learning together and thinking through how we shift our agencies in order to promote trauma-informed practice. And Holly, you know, you've really been working on that in your work at IWK in Nova Scotia. Maybe I'll just let you speak to the levels of education you've been offering there.
Sure. Thanks, Nancy. So yes, as I mentioned, we really focused on doing education for everyone. So that's looking at the level 1 education. We did a foundational education, looking at what does trauma-informed care mean, what does it mean to them, and how do they do that in their practice. So again, focusing on the previous slide, really looking at having that education, but then what do I do with it? What do I change in my practice, and how am I supported to do that? So now we're really looking at supporting staff psychological safety within that level 1. We're looking at providing different ways to change maybe your physical or emotional spaces within your organizations or teams, looking at all of those aspects that can contribute to a trauma-informed environment. So, and again, for everyone in our organization. When we get to level 2, looking at, we mentioned about regulation and self-regulation, we're looking at, and this gets into kind of more about a systems approach, but also trauma treatment, so looking at the attachment, regulation, and competency training. And this is for all of our mental health and addiction staff and identified teams within our health center. So it's really looking at, again, you know, the impact of attachment, the impact of trauma, how do we self-regulate, how do we help our clients to do that, and also how do we help ourselves to do that, because we need to manage our own affect, and that's a huge part of it too when we're working with clients. So really looking at that level for level 2. And then level 3, kind of layering that and saying, okay, we all have this foundational training, this attachment regulation and competency training, and now what do we need for specific trauma treatment? And really looking at that, and that's where we're at currently, looking at what other additional trauma treatments do we need and how many staff need the training, what support do we need, and really looking at champions for this work, looking at supervision and case consultation, because we know one-time education, you know, is great to get conversation going, but it's not going to sustain what we want to do. So really looking at how do we embed that support and practice and sustainability and case consultation into the work daily.
Neat. I also found lots of other places where people are really focusing on education across the country. The Manitoba has really been working hard on from their Knowledge Exchange Center at the Addictions Foundation of Manitoba in sharing and all kinds of things to support learning. The EENet folks in Ontario have lots of materials on their site, and lots of webinars have been done, and I know I get messages every day about face-to-face approaches, that workshops and whatever that are being held throughout Ontario. So really a lot of focus on this idea of learning together. And you know, in BC, the Indigenous cultural safety approach is really being advanced through monthly webinars that reach people all across the country that, you know, bring in this idea of cultural safety and trauma-informed approaches. So I feel like this, you know, we really are at this moment of trying to give best ideas about how to integrate this in practice through various learning mechanisms. And, you know, in the course of this project, we really do want to create a whole range of tools and resources and links to things that are helpful to people as you are trying to bring this into the substance use area. Now, another big part, I think, of the agency level work is working with partners, and I just wanted to turn it over to you, Lucy and Julia, for a minute to just talk about your experience with, you know, bringing partners into your process of being trauma-informed.
Sure. Thanks, Nancy. One of the areas that we've really been focusing on a lot is child welfare. And in a very collaborative engagement with the Toronto group, which then extends out to the province, we've been doing training for all staff right across the city, a couple of hundred staff, and looking at, as a follow-up to those workshops, doing very specific kinds of training with foster parents, for instance. We're also doing, sharing some of the work that we're doing in our child care center with parenting and trauma and attachment therapy as well, as kind of something that we can take out into the child care networks across the city as well. And also housing is another sector that we're very much involved with, both in residential programs that treat substance use and mental health, but also in our supportive housing sector. And you know, quite recently we had the opportunity to contribute a competency standard around trauma-informed practice in housing. So it's you know, being at those tables and continuing to raise it multiple times wherever we can to ensure that it's a cross-sector effort. Justice is another area that we're doing extensive training with. And most recently, some support around evaluation efforts. Julia, maybe you want to speak to that.
Sure. So this is newer for us, but just as an example, last year and again this year, our evaluation folks will offer to people who are enrolled in a course around evaluation how they can integrate a trauma-informed lens into their evaluation framework and their measures. And it's really interesting to see how you can braid those two.
Neat. Yeah, thank you.
And that's a piece that I think we can contribute to the research and evaluation efforts across the board. And there's a great spin-off element to doing all of this. That when we do it in one program or one sector, then the application across sectors becomes apparent, and there's a great deal of pickup. Education is another area we've been working with some of the school programs for pregnant and parenting women. You know that trauma-informed practice is something that they're looking at as something they want to adopt, but they don't quite know how to integrate it in their system. So we're probably doing 3 or 4 trainings a month, both within our sector and across sectors.
I also want to make a point, too, just harking back to a wonderful comment that was made earlier about a learning model of 70-20-10, where we understand that a certain kind of learning happens in the moment in the workplace environment. And one of the networks we're involved in, and this is a shout out to all the agencies involved in that network, is the Women's Mental Health and Addictions Network. And that's a great opportunity through capacity building, whereby agencies partner together to deliver a trauma-informed group. And that way there's capacity building for both agencies.
Yeah. And that's the same as the one in the that the Victoria Sexual Assault Center did with the addictions field. You know, that idea of bringing the expertise of both substance use and sexual assault together, and then really thinking about how to do a trauma-informed approach to working on those issues with that population. So really, you know, I think this is exactly what we're learning. Is it's a lot about how we work together to create a kind of a net of support for people accessing services. So it's not just, you know, one place they go to that they can feel safe, but that we've really done the work system-wide.
And similar to what others have said, we've created something locally that we've we think of as building resilience, and it's kind of a pre-trauma program that is available to all women who go through Jean Tweed, and it's really a readiness component that if they're, struggling with the symptoms of trauma and so on, that they can go through this program, which is how long, Julia?
It's 4 weeks, and it's educationally based, so it's an opportunity to sort of dip your toe in and learn just enough about trauma to get a sense of whether or not it's something you want to look at further. And it also helps women make the links between the trauma and the substance use.
And the coping skills that they require if they're going to go beyond simply substance use treatment.
Yeah. And I think that's what was so important about those 3 sessions at the Victoria Sexual Assault Center, is that women did get a chance to just try it out, and they didn't have to commit, and it wasn't a failure if they didn't come back right away for the second of the 3 sessions that were kind of preliminary. You could do them at your own time, and, and it was really, I think it really broke down a fair number of barriers. And, the other side effect of it was that it completely eliminated the waiting list, right, for individual therapy, because you weren't necessarily, and everybody could access something right away.
Yeah, it really helps.
So, Nova Scotia and the Jean Tweed Center and many others who have really been focusing on education and really trying to bring in safety and whatever. We did find one other organization online who has actually talked about very explicitly in a document about, quotes, harnessing the learning community model to integrate trauma-informed care principles in service organizations. And here are some of the domains they saw as really important. Again, emphasizing the consumer-driven care and ongoing, quality improvement and partnerships and, education, et cetera. So really, more and more, I think, are focusing on what's our work as organizations to bring trauma-informed approaches forth. And the last thing I wanted to mention before we stop and have a bit more discussion is just that we found lots of resources online, and we are interested in creating more resources that could be helpful, like checklists and discussion sheets and pamphlets and screensavers and posters and bookmarkers and any other things like that that could be really helpful to you as you go forth in organizations to create change. So just really want to mention that, and hopefully people online will give us some ideas of whether any of these have been really helpful. The one pamphlet in the center from CAMH is quite an old one, but I think is a really excellent explanation of trauma in plain language and some of the effects, et cetera. And then the poster we did in BC there beside it, the effects of trauma, is another one. And we can be, reproducing these kinds of things, or we can be doing other kinds of things that are really helpful as we go forth in this project. And we're very grateful to have the funding from Health Canada to be able to, be a kind of a catalyst for this kind of learning together and bringing trauma-informed approaches into our systems of care in the substance use field. So I'm just going to open it up again for us to look at some questions or comments about, what do we need now as we go forth. I notice, Rose, you've been trying to answer some things along the line. Do you see anything in particular that we should answer at this point?
Thanks,
you must be on mute.
Yeah, I was. I'm here. There was a few questions. I've pulled them together. Let me just have a quick look through them. Some have been answered. Emma in Yukon asked us, their facility does bed checks twice a night, and was told that this is a common practice for safety. She was wondering what the panel thinks about whether or not this is trauma-informed and if there's alternatives.
Sure. Well, we do bed checks as well, and we've talked about it, thinking about the principles of trauma-informed care and how to make sure they happen as safely as possible. Certainly at the front end, we stress to women what the purpose is behind the bed checks, and we talk to them about it, and we connect it back to the principle of safety in terms of trauma-informed care, so that they understand we're not doing it to be intrusive, that it's coming from a safe place. We also try to be really sort of gentle and respectful when we do it, and use our skillfulness in attending to the impact that the bed check is having in the moment. So if we're doing a bed check and it looks like it's having any kind of impact on somebody, we're going to be attuned to it and we're going to be responding right away. And it's also in the way we enter the room, the tone of voice we might use if the person is awake, and as I said, how we respond if there isn't any kind of reaction. The plus side of doing the bed checks in terms of a trauma-informed approach is that if anything has happened for a woman in the night, if she is in any kind of distress, we're showing that we are available and ready to provide support. Oh, yes, and, you know, I think things in the room that can make it feel safer for people, the bed checks, but also just the room in general, things like night lights, for example, being able to play soft music with headphones so it's not interrupting anybody else, but things just to make that environment safer for somebody.
I think we've had a number of requests from women. Some women would like the blinds completely closed to give them a feeling of safety, and other women may want the blinds completely open so that they can kind of assess their environment in the same way, looking for safety. So it's recognizing that many of these requests originate in a trauma history, and looking at them in a way that always is respectful and comes back to doing everything we can to create an environment of safety for the women.
And sorry, just to add to that, of course, a core always is the building of the relationship.
Yes.
So where any individual woman may have concerns about bed checks, we're going to be inquiring with her what it is that could be upsetting or distressing for her, and on an individual basis, looking at what would be supportive for her.
Hi, it's Denise from Heartwood Centre for Women, and this was a great question because we've also struggled with that here in Vancouver. And I just want to add to my colleagues across the country that the piece that I find that is most valuable when women are showing distress from room checks is to really, as you said earlier, really explaining the context of them, why we're doing them, what the relationship is to safety, and then asking them for their ideas as to how we could best do this in a way that would be most safe and less intrusive, least intrusive for them.
Thanks. Other questions?
So we have another question. There's been a few people who have acknowledged and appreciated that we've included Indigenous forms of wisdom. And one question about whether or not there's been consideration of other types of traditional wisdom to be included in trauma-informed practice. And then they made a reference to the work of Jean Vanier.
Yes. And, you know, I think that that's what makes trauma-informed practice so important, is that it is coming from so many directions, you know, from all sort of places that are oriented towards kindness and compassion and engagement and support, right? So you can see many traditions woven in. One of the other ones I see very much woven in is the kind of Buddhist sense of mindfulness and compassion. That's really, you know, part of that tradition. But, you know, really you can see many, many forms of wisdom that connect up to this approach. And that's why I feel we're at such a great moment in our development in the substance use field to really starting to think less about, you know, the way we've always done substance use treatment and prevention and whatever, to really widen our lens to incorporate what we're learning from neuroscience and indigenous wellness, from mindfulness, from, you know, trauma theory and early attachment, an understanding of early attachment, disruption, et cetera. So, you know, it is a wonderful moment for us. But, you know, I also feel really strongly that now that we have all this kind of wisdom in our hands, it really behooves us to bring it into our practice. And we can no longer say, well, you know, that's the way it's always been done. But really, we now know the impact of trauma. We now know that there are things we can do to really mitigate the impact, and where people want to link them up to, you know, deeper healing. But that I feel the substance use field has a responsibility now to take up this learning about trauma-informed practice and figure out in each of our contexts with each of the people we work with to quotes, get it and apply it.
We have a couple questions about other cultural perspectives, particularly related to immigrant clients and refugees and newcomers, and whether or not there is specific materials on that or organizations that are working on trauma-informed practices within these populations.
I don't know whether
Hi, it's Holly. In Nova Scotia, we're
great.
working a lot with our Immigrant Settlement Association of Nova Scotia, and they gave us a lot of great tools and resources, some done in Canada and some in the U.S., so we can definitely, if people are interested, kind of send those out because they've been very helpful working with newcomers that are coming to our country and how to think about it and balancing out the trauma and resiliency too, I think is a big piece that we've been learning with that. So definitely a lot of work, I think, that, you know, has been done, but I think a lot more to do. I know definitely even from the IWK's perspective and how we do that, you know, in a more systemic way again and a bit more, you know, kind of working together to meet those needs.
And I see some of those, Holly, I've just gone back to that slide there of your website that you've built around the trauma-informed approaches at IWK. I know there's a lot of resources there. I'm sure some of those you've mounted already in the
Yes, we continue to do that too. Yes, thank you.
So
it's an ongoing, as we know, right? Lots of great information out there.
YourExperienceMatter.com is where Holly's work has been posted as they develop this plan to be trauma-informed at the IWK and beyond in Nova Scotia. And so I know there are some things there that could probably be really helpful. Just when we're talking about where to find things, I'm just going to go for a second to say that in our work to, you know, find things from all different locations, we actually built a little list which is growing, again, daily, that's mounted on the Center of Excellence for Women's Health site. And we'll soon have a special section in our site for this project specifically, but even now you can download this listing. And we have tried to include, you know, work with men and boys and Indigenous, immigrant and refugee, et cetera, plus some of the old standards in our list. So we really encourage people to go there and download that. And we provide a little description of each one and links to how to access them online. It's a whole new world, in terms of sharing information. We have so much at our fingertips now.
It feels
I
like
also wanted to just highlight
for the information. It's Lucy here again. One of the things that we've done in the past year is reach out to the agencies that are working with the refugee population in kind of a train-the-trainer capacity, to offer them training on recognizing the impact of trauma, the symptoms of trauma, so that they may, you know, increase their skills and competency in working with that population. And also in the child care center, just almost in a trauma-informed respite service to women with children who have just recently arrived here and have had very traumatic experiences, and their children as well. So making that available to them has been something we've done. And we're also working with local service in relation to human trafficking and providing training and support to their staff as well. So it's extending beyond the limits of just substance use, and certainly, as you mentioned, Nancy, training for agencies that work with men as well. We're certainly seeing the benefits of that as well.
When we did the Becoming Trauma Informed book, Lorraine Greaves and I edited that with the support of CAMH. We found that there were a number of immigrant and refugee agencies, you know, beginning to do this kind of thinking. And really, you know, we found a lot of support for working in a trauma-informed way that many, the immigrant and refugee agencies we talked to in the course of the development of that book often mentioned how even though people who were leaving very difficult situations and had, you know, quite a lot of exposure to overwhelming events in their lives, many of them, when they came to Canada, actually really wanted agencies to work in a trauma-informed way rather than pushing them towards treatment per se, that they really wanted to stabilize, learn, you know, get a job, you know, be integrated in a more low-key and social way and a financial way, even more than they wanted to go for mental health counseling. So it was just kind of a really strong statement from them about how important trauma-informed as well as trauma-specific services are. All righty. Well, what else, Rose? You started to say something that you wanted to mention.
Oh, I just wanted to mention that we will be setting up a communication method for this project, likely an email list, and I'll be sending out that information when I send out the evaluation survey for this webinar. So if you're interested in finding out more about the project, attending our future webinars, or receiving links to these materials that we create and ones that have been created, please opt into that listserv when we send it to you.
Great. So I'm not sure.
We have a couple more questions, but I'm not sure if we have time to cover them today. Do we have time for one more question?
Sure, one more.
Okay.
I think we can, and then we'll wrap it up.
Okay. So the question is that we already provide training for our staff on setting boundaries and redirecting the conversation in trauma-informed ways, but I'm wondering if there's something more that can be done. Often our clients will enter into trauma narratives with staff who are not clinicians during times when there are no counseling staff present, for example, evenings and weekends. How is this best to be managed?
Hi, it's Julia from Jane Tweed here. That's an excellent question, and it's not uncommon at all for staff, whether it's direct or indirect service staff, to be a bit wary about this whole topic of trauma because they're concerned once they raise it that this is what will happen, that it will unfold into trauma narratives that will then unfortunately result in someone being re-traumatized. So the question becomes, how can we work in a trauma-informed way such that when someone feels really comfortable and welcome and feels that they can raise the issue of trauma, what can we do in those moments to help it unfold in a really safe way? And so one of the things for us as a center is the importance of training all of the staff, both direct and indirect staff, admin staff, the cooks, everybody, and what it means to be trauma-informed. And so how to be really warm and welcoming and create a really safe space. And then when the issues of trauma come up that are specific, how to support the person in that moment so that they don't end up in a situation where they're re-traumatized. So how to deal with, from a perspective of headlines, how to redirect a person, how to provide containing and grounding for somebody so that they have an overall safe experience.
Neat. Thank you, Julia. So just to wrap up, we have lots of resources and hope we will be in touch with you as you explore them. And we do really want you to let us know in the post-webinar evaluation survey if you want to be proactive with us and presenting on your work in future webinars and joining a more in-depth look at some aspect of trauma-informed practice and gender-informed approaches through joining a community of inquiry and or being part of developing resources that you think we might want to be developing at this point to keep the practice moving forward. So really appreciate your participation today and really hope you'll join us for the next webinar on March 14 on gender-informed approaches in the substance use field. And Dr. Lorraine Greaves and Natalie Hemsing from the Center of Excellence for Women's Health will be key presenters there, and we'll probably include lots of others as panelists as well. So do let us know of your interest, and really appreciate your joining us today.